Hey guys, this is Dr. Herb. In case you haven't subscribed, please do subscribe for updates. Let's differentiate between the mesothelioma versus the adenocarcinoma. So looking at the calretinine, that is a WT1, CK56 or the D240, that is a podoplanin. So all this is positive. It is positive where? It is positive in case of the mesothelioma. Then the TTF1, this becomes positive in case of the adenocarcinoma. And the carcinoma embryonic antigen, this is negative. It is negative. So to make it easier, let's look at what is positive in mesothelioma. So mesothelioma, the calretinine is positive. Then comes the vimentin. Vimentin is positive, as well as a low molecular weight cytokeratin. So it is the vimentin, the low molecular weight cytokeratin. So all this becomes positive. So all this is positive. Then the electron microscopy features, it is long and sinus villus. So electron microscopy, it is going to be long and it is sinus villi. So now let's move on to the adenocarcinoma. So in case of adenocarcinoma, whatever is positive becomes negative. So what is positive? Positive is the TTF1. The TTF1 is going to be positive. TTF1 is positive, as well as the carcinoma embryonic antigen becomes positive. So these two are positive in case of the adenocarcinoma. And the electron microscopy features, it is short, it is straight, and the villi, if you see, it is fuzzy glycocalyx with fuzzy glycocalyx. To learn and grow daily like this, please do subscribe.